probably him. And we sort of like we met through Twitter. Since you're talking about Twitter, I met this guy on Twitter. Then we got together and we said, let's start something. And it's good to see that it's still alive, still running, and seeing this kind of events. So that's very fulfilling.
Ellie, do you want to give a quick introduction before we start?
Yes, hi. It's really nice to finally meet you. So yes, I'm Ellie. I'm one of the event coordinators. And I'm just gonna introduce briefly Dr. Henriquez. So as he said, he is from Dominican Republic, and he's currently a PGY2 at Rush PM&R Residency Program in Chicago. And his expertise is in sports medicine, and it was demonstrated during his tenure as the head team physician for the Dominican Republic national soccer team during the 2022 Qatar qualifiers. And he also has gained experience as a research assistant at Rehabilitek, an outpatient PM clinic in Santo Domingo, where he focuses on sports medicine. And he is committed to extending medical assistance beyond borders. And he recently led an international medical mission trip in his home country of Dominican Republic, and the first Rush PM&R medical mission trip abroad through the global health track. And he's going to be giving us a presentation today on sports medicine and on a sports medicine clinic case. So again, thank you all for joining us. And yeah, we're very excited to hear your presentation.
Yeah, thank you, Ellie. Again, thank you everyone for joining. I just want to be, I don't want to have a very long presentation. I just want this to be as interactive as possible. We're going to do a case, but before doing that, I just wanted to give you a quick highlights of what is it that we're doing. We're going to do simulate a case that we are, I don't know, in an MSK clinic, and we have a Spanish-speaking patient, and just presenting with chief complaint, and we're going to go through the diagnosis, and we're going to ask the questions that we need to ask to get to the diagnosis. I'm saying this, another thing that I'm going to say is we're doing part of a physical exam too. In bed, between the sheets and everything, get some pans. We're going to move you around. I want to see the cameras and I'm going to assess you all guys and see how you're doing so far. So let me start the case. So let's say that you're in I don't know, maybe in a community clinic, and you're seeing this Spanish-speaking patient, and this patient comes with this presentation. This is what they say. I don't know if someone wants to read that out, and we'll see how much you can capture from the highlights from this chief complaint. Any volunteers?
I can start us off. Yeah, so it says, ay, doctora, me duele la cadera derecha desde hace como 2 a 3 meses. Una noche, mientras estaba durmiendo, sentía dolor cuando me apoyaba del lado derecho. Ahora cuando corro, camino, subo o bajo escaleras, me duele mucho. Siempre he sido una persona muy activa, corro maratones y hace poco empecé a entrenar para ser triatleta.
Yeah, thank you, Luis. Just by hearing that, I don't want to see if some of the people in the audience can say what's a really highlight, what it's very, very relevant from this chief complaint. We're gonna dig deeper and see what are the things that we can capture from here just to get to the diagnosis. Any volunteers?
I guess I would say that she recently started training for a triathlon, and now she's feeling this pain even when she's sleeping. Well, it woke her up.
Yeah.
The pain.
Yeah, so there's a change, there's a shift in activity. So there's an increase in activity. Again, we have to go to the chief complaint, like what's hurting, and it's actually the right hip. And it has been hurting for 2 to 3 months. We know when the pain usually appears, it's usually at night. That's what it says here, that whenever she lays like lateral decubitus position to the right side, there's a lot of pain located to the hip. And now whenever the patient is running, walking, climbing, or just walking down the stairs, there's a lot of pain to the right hip. I'm just gonna give you another hint. It's the lateral aspect of the hip, okay? And then very good. These are the highlights, right? So it's on the right side of it's on the right hip, 2 to 3 months. It's the timeline that we have for this pain. And we have this shift in activities. This patient is very active, runs marathon, and now is training for another marathon, and it's a triathlete. That's how you say it. and and I'm bringing up this because this is a post that we did maybe like 2 years ago. I was part of the people that make this art over here and came up with the top 10 questions that you can ask for any MSK pain visit. And again, whenever we have a chief complaint, we want to see when this pain started. When did your pain start, and how often it occurs? And how do you say that in Spanish? And I don't want to take over. I just want to have the audience just help me out. So who's willing to help me out?
I can say it. ¿Cuándo empezó su dolor y qué tan frecuente es?
Yeah, so we're asking about the frequency, and that's something that when did the pain start, and then the frequency, and that's something that's on the case, and it started 2 to 3 weeks ago, and it initially appeared when the patient was laying on the right side of her body, just like in the lateral decubitus position, and now it even appears when the patient is walking, and then. One of the things that I usually ask my patients when I'm trying to get to the location, talking to a Hispanic patient, I'm just thinking about my mom. If I ask her about something, she'll jump and give me maybe like 10 places, right? I tend to ask them with the finger, can you show me where the pain is? And this is they'll let you know where the pain is. And how do you say that in Spanish? Con un dedo, which is with a finger, can you puede enseñarme dónde está el dolor? Can you point me where the pain is? And they're going to be able to show you where the pain is, and it's to the right head. And then you ask the patients to describe this pain. Is it something, how will you describe this pain? Is it sharp, burning? And how do you say that in Spanish? You can say, for how would you describe your pain? You can ask them, ¿Cómo describiría su dolor? And whenever you say you in Spanish, you have two ways to say. You can be like very formal, and that's usted. You can say tú. So if we want to simplify everything, we can go with the formal way, which is usted, because if you choose tú, then it changes with if the patient is a female or a male, and then if you want to keep it formal, it's only you can use usted, and you don't have to worry about the gender that much. And then from the history from the patient that we have, it was saying that the pain is, bueno, siento que hay algo que me puya y me aprieta. Can someone tell me what this means and what this means? Puya fuerte y me aprieta. It's not fair, Lucila. Come on.
I can start. Puya means like poking. I feel like something's poking me. And then aprieta is like squeezing. Something's like squeezing me.
Yeah, that's right. And then if you want to ask them how severe the pain is in a scale from 1 to 10, you can ask, en una escala del 1 al 10, ¿qué tan severo es su dolor? And they'll be able to tell you if you ask them that question. And then you can ask them the progression of pain, and you can ask them su dolor, and then usted, like going back, why do I say su? Because I'm going with a formal way of you, which is dead, and then I can ask them, su dolor ha ido cambiando con el tiempo, your pain has been changing over time, and from the chief complaint that we have is that the pain is actually getting worse over the last couple of weeks. Siento que en las últimas semanas se ha ido empeorando el dolor. And I think that I'm going too fast. If you have any questions, anyone, if I'm going too fast, if there's something that you don't recognize from the case that we have over here, just stop me and we can go. We can go slowly, and I can help you navigate this process too. Can anyone help me with this part over here?
I could do it. So, ¿hay algo que mejore su dolor? ¿Hay algo que empeore su dolor?
Yeah, nice. And then, so that means hay algo que mejore, which is there something that improves your pain? Or hay algo que empeore, which is worsens your pain? Is there anything that worsens your pain? And from the history that we have from our patient, she's saying that the pain gets better with ibuprofen and acetaminophen, and it worsens with just climbing up the stairs or running or even walking, or when doing. Does someone knows what sentadillas means?
Like squats?
Oh yeah, squats. Yeah. So whenever the patient is doing just climbing the stairs, running, or even walking, or doing squats, the pain worsens. So another question that we ask our patient when they're having any pain to any of their limbs, we want to rule out that it's coming from somewhere else, like the spine, right? And we can ask the question if the pain is radiating from someone. Is the pain, so how do you ask that in Spanish? Is el dolor se irradia? But when you say irradia, I don't know if in any other country, but if you ask that in the Dominican Republic, they will look at you and be like, huh, what are you saying? So you can ask them, el dolor se mueve, is the pain moving somewhere else? El dolor se mueve hacia algún otro sitio. And that way they're going to be able to tell you if the pain is moving from some area to another area. And for this patient, they're saying, can someone tell me what this means in Spanish? Can someone make the translation on this box? What this patient is saying.
I can read it. So se queda ahí en la cadera. So for that part, she's saying, or they're saying that it stays in the hip. Pero en las últimas semanas he notado que se ha ido corriendo por el lado de afuera del muslo. So she's saying that it stays in the hip, but in the last few weeks, she's noticed that it's moving down the outside part of her muscle.
Yeah, nice. And then if you want to ask the patient if there's something that led to the pain, like, can you remember if something, there was an incident that caused the pain, you can ask them in Spanish, ¿recuerda algún incidente que causó el dolor? And yeah, so that's pretty like straightforward. And again, I was trying to find the link for this 10 questions that we had in the past. It's in the, I think that is in the AAP Instagram account. I couldn't find the link. I had it before, but if I find it, I'll send it to Ellie and then she can redistribute that. I think that is very helpful. And it gives you like a system and you can walk whenever you have an MSK complaint, and I think that it makes your life easier at the end. And then like precipitating event. So the patient is saying that she doesn't remember she cannot recall well, but lately she has been training for a marathon, and it started right after it. And then lastly, has anything that's happened before? Algo como esto ha pasado antes? And then she's saying that never nunca me había pasado algo así. So nunca is never. Never in the past I had something like this. And then associated symptoms. Any additional symptoms, you can ask them in Spanish. And again, this is the formal way to say usted tiene algún otro síntoma adicional? And then she's saying that, no, doctor, it's only that for now. And then this is a bonus phrase. I even do this in Spanish, right? And when I try to do patient and I want them to do different like maneuvers, I can ask them to mirror me, and I just tell them, por favor, haga como yo. And it's like, please do as I do. And you don't have to be like, oh, now flex your arms, bend your elbow. You just do it. Just stand in front of them and do all the things that you want to do. And that can help you. It will give you a break in your brain and not looking for all those words in Spanish, right? So I think that is very helpful. Now, question for the public over here. What do you think that the diagnosis is? Let's drop it on the chat. I think that we have a very shy audience from what I can tell here.
Henriquez or bursitis?
Drop it in the chat. We'll find out. Just let us know. A, B, C, D, E. Nice. It seems that everyone got it right. So yeah, it's trochanteritis. This is something that usually tends to appear in someone that has a change in their activity, and it's usually a pain that whenever we're saying greater trochanteric pain syndrome, there's some structures that actually insert in the greater trochanter, but one of the major structures that we look at, and that is getting a lot of popularity lately, is the gluteus medius. And the gluteus medius, it's one of the structures that gives you like within all your hip muscles, whenever you're doing a single leg activity, it's the one that stabilizes the hip and that makes sure that it stays in midline. And what am I saying with that? There's a specific test that we can do just to test out how your gluteus medius is. And before starting, I told everyone, if you were like within your sheets or just very comfy in your sofa, just make sure that you have some pants over here because we're going to be assessing your gluteus medius right now. I want you to do with me a single leg squat. And then why we're doing a single leg squat. The single leg squat, it tests out a lot of muscles, but something that it can tell you is just from doing a single leg squat, you can see if the patient is doing having like a hip adduction, like adduction. The gluteus medius is a hip abductor. So let's say if you're doing a lot of adduction, it means that your gluteus medius is not activating as well. And that's why within the PT program that you do for greater trochanteric pain syndrome, you target the gluteus medius a lot, and you try to strengthen all the core muscles. But one of the major structures that you make sure that you strengthen is the gluteus medius, and it's because the bursa, it actually covers part of the gluteus medius, and if it's weakened, there's going to be a lot of friction between the gluteus medius and the bursa. So that's why if you strengthen the gluteus medius, it won't have a lot of friction. And then over here, what I have is where the bursa is. You can see here the relationship that it has with the gluteus medius, and you can see this little like pillow with fluid, and this is the bursa. And usually the patient will describe some pain over here. But if we think about this deeper, one of the things that you have to keep in mind is whenever you have greater trochanteric pain syndrome, yeah, the bursa is distended, but we have to go and see why this bursa is distended. You can go and do an injection. With that, you're just treating the consequence. You have to go to the root cause. And that's why the single leg squat will tell you a lot of information about how the hip muscles are doing so far. And it'll tell you a lot of information of how the gluteus medius is doing. And whenever you're talking about greater trochanteric pain syndrome, you can have a lot of etiologies. It can be a traumatic etiology. Maybe the patient was running and then suddenly had a fall and landed to the right side of their hip. And then you have a distended bursa. That's something different from a patient that is training for a marathon. A patient that is training for a marathon is going to be activating that gluteus medius a lot. And eventually that gluteus medius is going to fatigue and then create a lot of friction in this area. Because whenever you run, if you think about it, it's like doing a lot of single leg squat. You're running, but at some point the one leg is in the air and then the other one is taking all the weight bearing. So it's sort of like a single leg squat, and that's why we try to do a single leg squat to see how your gluteus medius is. And you can see what I was talking about, things that you look at for a gluteus medius, so for the single leg squat. You see if the ASIS are aligned, and you ask the patient to squat down. And over here, if you look there, what's happening on this side of the screen, you can see how this knee is coming down to the middle. So this gluteus medius is the one responsible to keep this knee from adducting as much. So this is a positive gluteus medius test. I just wanted to see, I'm going to ask real quick if we have any athletes here joining us, any runners, any, I don't know, like cyclists or people that consider themselves very, like pretty fit. And if not, we're going to test your gluteus medius regardless. Wow, all these people going into
It's
PM&R,
been a while,
and no
but
one
I
is
can
involved with.
maybe- I said it's been a while, but I can maybe take one for the team.
You're going to take one for the team? Oh no, everyone is doing it. No.
Oh,
This is
okay,
not
great.
it's not like one for the team. So everyone is turning off their camera, on their camera, and we're gonna see how everyone can do with this single squat. Yeah, everyone. Yeah. And then usually what you do is you ask your patient, you're gonna be like, if you tell them haga como yo, like, come on, you got to do it too. But I'm going to give you a trick. You're going to do it with both legs, and you're going to figure out which one is your stronger one, because you don't want to make shame of yourself in front of your patient. My stronger side is my right side, actually. So that's why I'm picking my right side. So everyone, well, come on, guys. I need cameras. Come on. All right, this is awesome. So what we're gonna do is we're gonna stand on one leg, right? Everyone ready? And let's drop it down a little bit. Just make sure that your knee is aligned, it's in the middle, and it's not coming to the, it's not adducting. So drop it down a little bit and then go up. The actual let's gotta do it at times. That's what they say. And you're gonna figure out how you do with it. So you drop it down a little bit and then come up, drop it down a little bit, come up, drop it down a little bit, and then come up. And that's gonna give you information about how your gluteus medius is doing so far. If you see that it's coming down, that it's adducting as much, or if you're leaning forward, that's another one too. If you're bending forward just to stabilize, that tells you a lot of information about how your gluteus medius is doing. Or if you're sort of like tilting to the side too, just to find another, to compensate and find more stability, that tells you that your gluteus medius is not as strong as that you. So for all the gym bros that are here on the chat, guys, you have to do a better job. It's not about all biceps and back and triceps. You gotta hit the head, man. Otherwise, well, you'll see me down the road when I do sports medicine then. Let's see. And then again, this is more information about greater trochanteric pain syndrome, boss words, what are things that are gonna tell you information about and lead you to the diagnosis. Why the patient will say they have lateral hip pain whenever they try to climb up the stairs. Again, it's like doing a single leg squat. Like whenever you're climbing stairs, you bear weight on one side and then you try to push up. So that's activating the gluteus medius and leading to that pain. And then that bursa is very superficial, so you can actually palpate to the greater trochanter area, and you can find a lot of pain too. And then why there's pain whenever the patient is laying on that side, again, that's a very superficial structure. And whenever you lay on that side, there's a lot of pain. And then the single leg squat can tell you a lot of information. A bunch of runners in the Dominican Republic, and whenever I did their single leg squat, God, they sucked. Any questions at all?
I actually have a question, just more so of a from diagnosis perspective. Differentiating this trochanteric pain versus like IT band pain is the only thing, like would be the squat test, or how else would you differentiate?
That's a very good question. Have you heard about the term muscle chain?
No. Muscle chain?
No. So yeah, muscle chain. So there's a lot of muscles that do the thing, right? And a lot of structures do the same thing. But then you have a primary one. And the gluteus medius, it's a hip abductor. But then the IT band is sort of a hip abductor. But let's say that the gluteus medius is it's not super strong. Who do you think that is going to take over? The IT band. And then that's how you can have more than one diagnosis. There's a guy that is like the main issue, it's the gluteus medius most of the time. If you look closer to the PT programs and you have knee pain or even quadratus lumbrarum pain, you're going to target the gluteus medius because all the structures are in the lateral aspect of the body, and those are abductors. And so what the focus is strengthening the main abductor. That way the other ones don't have to compensate. So going back to your question, I tend to ask, whenever you see this patients, they'll tell you that they have hip pain and knee pain. So they tell you they have both things. But what I ask them, what gives me the most information, I ask them, what came first? What happened first? And they'll say, started hurting, and then now in the lateral aspect of my thigh, I'm having some pain and a lot of tension. And then you do an Ober test, and you find that the IT band is very, very, very tight. Are you familiar with the Ober test?
Yes, I am.
Yeah. So again, you can find, and even if you think about this, and if you do a very quick encounter, you can think that it's coming from the back. Like you have a lumbar radiculopathy, because the pain now, it's not located just to one part of the body, but it's that time that you spend with the patient just looking what came first and how's the pain, and doing a good physical exam is the one that is going to give you the most information. And then the trickiest part is sometimes you can have back pain because you have a very tight QL, because the gluteus medius is not activating as much, and then the QL has to do sort of a little bit what the gluteus medius is supposed to do, because it acts as an abductor too. So it's the gluteus medius is weak, so that's the major. Again, if you look closer to the PT programs, that's going to give you a lot of information of how the body moves and how all the muscles activate, and that's why it's called a muscle chain, because everything is connected. Like if you disrupt the chain in one area, it's gonna lead to I think that that's our art over here, is doing a very good physical exam and connecting the dots um with the chief complaint. Like we have to be very good at asking questions and just doing a very good physical exam. Honestly, I do like just doing an MSK exam and just talking to the patients. To me, it's super cool. Like just finding an over test that is positive, and then just describing them what's happening. And once they see you, once you have them do a single leg squat and they see what's happening with them, you can even tell them, just stand in front of the mirror and see how your single leg squat is doing along your PT program. If you feel more stable, probably the pain is getting better. So that's like a little thermometer that I use for my patients, and it gets them encouraged. Even for, let's say, like tendinopathies that are happening in the gluteus medius, it can actually present as a greater trochanteric pain syndrome and as bursitis. But again, the root cause is somewhere else. If you say that the diagnosis is only greater trochanteric pain syndrome, you're missing a lot of stuff. It's the same as subacromial impingement and subacromial bursitis. That's secondary to something else. So that's why the physical exam is heavy, and it's going to give you a lot of information if you find what's the mechanical cause, and that's where the art is. That's why we physiatrists we're very good at it. And since any other question, I was jumping to the last slide, but any other question? That was a very good question, Lucila.
Hey, can I ask a career-related question? I don't know if anyone else has a question related to the presentation before me. Can you hear me?
Oh, we can. Yeah. Go ahead, man.
Yeah, I was just asking what you did as a medical student to reach like this level in medicine, to follow Selección Dominicano, and
yeah.
then to become a physician. Do you have any advice?
That's a very interesting question. That's a very long story, but I'm a very lucky guy. I'm gonna tell you that. I had great mentors in that place that Ellie mentioned, Rehabilitek. That's actually, I think that's the place that gave birth to me academically. That's what I'll say. Everything that they were heavy on Sam. The doctor that works there, he's very, very academic. He's very well known in the Dominican Republic, and just working along his side, that opened opportunities initially with the Dominican Soccer League. And that was during the pandemic and all the sports ceased in the Dominican Republic. So everything was stopped. And the actually part of the government reached out to him and said, can we create a protocol? And he asked me, do you want to jump in this mission and create a protocol to return soccer? And it was challenging because of lack of resources, so made it happen. And soccer was the first sport to return in the Dominican Republic. And then the national soccer team wanted the government had a mission of diversifying sports. And it's because we're very well known for baseball. I'll say this, that's my unbiased opinion. Dominican baseball players are the best players in the world. I don't want to hear about it. Like, that's not. So they were trying to diversify sports and get soccer running, and the national soccer team needed a head team physician, and my mentor at that time, he recommended me, and that's how I got into the national soccer team. Initially, I was very young. I'm still young, but I think that at that time, I felt a little bit comfortable because worked with my mentor at that time. He taught me how to use the ultrasound, how to do a very good physical exam. I was already seeing soccer players, any kind of athletes, um, and then I didn't have them while I was flying with the team. So it was only my shots. So that gave me my confidence, just traveling with the team and calling my own shots. And then just before applying, I wanted to get more training in PM&R, and that's why I came here to the US. I wanted to get more and even subspecialize. So I applied for the match. But before applying for the match, I rotated with a doctor in Humboldt, Texas. His name is Craig DiTomaso. And it was a phenomenal experience. I didn't have any inpatient rotations. And that was just before applying, just before the match opening, applications opening. And I think that all of that just played a role into creating the perfect scenario for me to getting into residency here. And I'm very happy at the place where I'm at. We just recently, I'm very, it sounds kind of cheesy, but I'm very connected to the community. And we just came back from the Dominican Republic. We did a medical mission trip. It was the very first time that PM&R goes to the Dominican Republic from Rush. And that was very fulfilling. And it's something that we want to get running down the road. I think that hopefully I did answer your question.
Yeah, that was pretty helpful. It's a long path.
Yeah. The other thing that you can do, I think that one of the tools that is very helpful is Twitter. I imagine I did a lot of things via Twitter. I was like, when I went to a conference to AAP in 2020, and there was a talk about like PM&R and getting involved with Twitter and starting my Twitter. And I said, like, I don't have any other option. I'm going back to the Dominican Republic. I need to get connected to someone. And I started like sharing stuff that I was doing in the Dominican Republic via Twitter. And that's how I got involved with PM&R Medical Spanish. I don't know if you were here initially, but I don't know if you probably know Edward Pinjanel, but he was one of the first one just starting our medical Spanish. And together we created this, and it's good to see that this is still running. And yeah, and that gave me a lot of like people that I met down the road that even helped me out just building my application and reviewing my personal statement and my CV. I even got in touch with a bunch of like chief residents and I met a bunch of people just via Twitter. So Twitter is a powerful tool if you know how to use it. Any other question?
Thank you.
Yeah. Well, this talk was not as extensive as the ones that you have in YouTube. I thought about something different, something very focused on just having a case and something that you might see. So hopefully this is helpful. Again, any other questions that you might have for me? Anyone?
I have a quick comment, Dr. Henriquez.
Yeah.
First of all, thank you so much for the presentation. I did want to comment on what you were saying there at the end. I really appreciated kind of the unique perspective and different presentation that you provided for us. I think our members have asked, and we've tried to like diversify the cases or like the way we present medical Spanish. And so I think this like presenting medical Spanish in the form of a case presentation is something is different for what we have done this year. And so we really do appreciate you doing that. It was really informational and fun, and you got us out of our bed and our chairs and our seat. So great presentation. Thank you so much for doing that. And I'm happy also to share, if for the people that are here, I'm sure you're already kind of following PM&R Scholars Medical Spanish Network on social media and are like in the email list. We have about 250 members now at this point. And they're able to like join us for the large events, the small group events, and other activities that we put throughout the year. So thank you so much for kind of leading and head spearing this project and this idea. And I'm happy to share just how much growth we've had over the last year.
Thank you, Luis. It's pretty impressive. I kind of like went into the dark side when I matched. I was doing so many things at the same time that I didn't know that this was still alive. I got that email from Ellie, and yeah, it's good that we were able to collaborate again. Right here, I have this is like a professional Instagram account. I like ultrasound a lot. I'll start sharing ultrasound content down the road and just like educational content. If you want to, you feel free to follow. If you like ultrasound sports, well, I'll throw much more than that down the road, but it's a work in progress. And again, thank you for having me tonight.
Muchas gracias.
Siempre, Laura.
Okay, if we don't have any more questions, I think we can end the call. Thank you so much, Marcos or Dr. Henriquez.
Yeah, of course, claro. Have a good one.
Thank you.
Yeah, thank you so much.